the active straight leg raise test. So that's with you on your back. So this is a nice test because it tells you a little bit about the length tension of the muscles, of the hamstrings in particular. But also what we're interested in here is the effort that's required for you to lift your legs up. So there's a bit of watching the range of motion, and you could even measure it with a goniometer if you want to. And then also getting feedback from the patient or the client and saying, how does that feel to you? So for some people with hamstring strain, of course, as they pick their leg up with an active straight leg raise, they'll be nervous about it and they'll feel a pull in their hamstrings. So now, before we do this, could we see your tummy? Because this gives us a little bit of information as well. So if you can see the umbilicus, then what that allows is for you to understand a bit more about how the sling systems through the trunk are working. So we've got this anterior oblique sling system from the right shoulder to the left hip, and the same from the left shoulder to the right hip. So Emma, if you could just pick up your left leg straight up into the air there, then we can watch the umbilicus and then just pop that back down again, and just pay attention to how that feels for you. And then the right leg, and then back down. And we'll just alternate a few times. So left leg, good, and then right leg. Good, okay.
Alternating because?
Well, because we want to know, I'm guessing you don't have a hamstring strain at the moment. Okay, good. But if you did, then possibly, as you imagine it's your right hamstring, it might get up to 30 or 40 degrees and we'd see, this one's not getting so high. Mm-hmm. You might give us feedback to say that's getting painful or tight or, feels uncomfortable. So then we've got a bit of information. We've got, 40 degrees here, 80 degrees there. Mm. But what I was looking at there was the umbilicus to see if it stays central, okay? And what we saw with Emma is that when she picks up her right leg, the umbilicus deviates slightly to the right. So when she picks up her left leg, it stays fairly central, okay? So what that's telling us is that the sling on this side from the left shoulder to the right hip is slightly inhibited or decreased. Mm-hmm. So in other words, you're getting the movement there because as the leg lifts up, it's creating a pull on your abdominal wall and it's shifting it. That side is not shifting it. So if I was thinking about corrective exercises for you or rehabilitation style exercises, I'd be thinking about this sling here and how can I activate that sling? So it could be something like we could do a lower abdominal exercise where we alternate the legs. So if you just bend up the knees like that, and quite frequently I would use a blood pressure cuff or some other biofeedback device, but if a patient hasn't got that or doesn't want to buy one, then you can use the hand. So you can pop your hand under your low back, just so that the knuckles are sort of in the midline. Yeah. So that's the kind of thickness. That creates essentially a neutral spine. So Shirley Salmon's work suggests that that's the right depth anthropometrically for your lumbar curve. Okay. But what we want to do here is get you just compressed down against your hand with the back. So it's like you're trying to squash your own hand with your back. Okay. And then just maintain the same pressure there, but pick this leg up off the treatment table. Like that till it's vertical, perfect. And then back down and try and maintain that exact same pressure so it's not fluxing there, okay? Then try with the left leg, okay, and back down. And did you feel, either was easier or they're similar?
They're similar.
Similar, yeah, okay, that's good.
And if we had a blood pressure cuff, you'd be looking at the gauge.
Be looking at the control and see if there's any flux in that on that needle. Right. But what we could do with you, because we've identified that this side is slightly more deconditioned, we could give you a right-left exercise format. Right. So I might say, okay, pick up the right leg and then back down. So we can do that. And then back down, and again on the right leg and back down, and then the left leg. Okay, and then we go back to the right leg.
And all the time trying to keep the pressure constant.
Exactly.
I think as I put my leg down, it's harder. It's just there. It's harder to
control it. Yeah. Okay.
So it's a lengthening, I guess, of that chain.
Exactly. Yeah. It is. It's a sort of eccentric control as you're lowering it down. Yeah. So did you find that quite easy to lift your legs up, or was there any resistance or any sort of heaviness in the legs, that kind of thing? It felt quite easy for you. So again, a lot of people that are symptomatic, they may get hamstring pain, they may get low back pain, they may feel that one leg feels heavier than the other. And so if that's the case, then what you can do is you can go in and essentially do the job that the transversus abdominis should be doing. And that's to put a little bit of pressure. You find that the ASIS, and you just push across just with a few pounds of pressure. They say about 3 to 4 pounds of pressure, so it's not a lot of pressure. So I'm going to push across like that, and then I'd like you just to lift up your left leg again and back down, and then the right leg and back down. And did that make it easier or harder?
Yeah, it was easier.
Yeah?
Yeah.
Yeah, okay. So that's, you're always looking for the subjective feedback, but you can also look slightly more objectively at, how far they're moving the leg. So there's a little bit more to do with this active straight leg raise as well. So another thing that we can do is we can reinforce the multifidus and what the multifidus would normally do in stabilizing that lumbar pelvic region. So for that, you want to reach around the back here. And so you want to be just roughly at the ASIS level, and you're going to reach around to the back, towards the midline. So your fingers aren't right on the midline, but they're just either side of the midline. You're going to push upwards with the fingers and then just draw outwards slightly. So essentially you're doing up and out, kind of there, up and out like that. So, so we're here, up and out, and then if you just try picking up the left leg and see how that feels, and then the right leg, see how that feels. Gives a jump out the way. No, that's right. And then try without, see if there's any difference without. Sometimes there is, sometimes there isn't. But it's, it helps with the diagnosis.
They both feel a bit harder without, actually.
Do they? Yeah. And sometimes people be worse with the reinforcement. So it doesn't always work that it makes them better. You could do this, and if they've got an inflamed pubic symphysis, it might make it harder for them to lift the legs up because there's now a pain input.